Liver is dying. 12 weird signs of liver damage. If your liver could speak right now, it wouldn't scream. It would whisper. Through itchy skin, strange nail changes, cracked heels, or even pale stool. The scary part is that most people ignore these signs, assuming they're harmless or temporary, until serious damage is already done. Today, I'm going to reveal 12 warning signs your liver gives before it starts to fail. And by the end of this video, you'll also learn how to support your liver naturally, before it's too late. The liver filters toxins, balances hormones, processes fats and sugars, and breaks down medications. Unlike most organs, it can regenerate itself, but only if you remove what's harming it and give it proper support. Liver disease rarely causes pain early on. Instead, it whispers. Let's go through those signs one by one. Sign 1. Pale or clay-colored stool. Your stool color reflects how well your liver is working. A healthy liver releases bile, which helps digest fats and gives stool its normal brown color. When the liver becomes inflamed or fatty, bile flow slows or becomes blocked. As a result, stool turns pale, gray, or clay-colored. You may also notice stool floating, appearing greasy, or sticking to the toilet bowl, which means fats are not being digested properly. This is often an early liver warning sign that many people ignore. Sign 2. Poor night vision. Trouble seeing in dim light is not always an eye problem. The liver stores and activates vitamin A, which is essential for night vision. When the liver is stressed or damaged, vitamin A is not delivered efficiently to the eyes. This can cause slow adjustment to darkness, blurry vision at night, or difficulty driving after sunset. Many people blame age or screen use, but when poor night vision appears along with fatigue or digestive issues, it may be a quiet sign of liver dysfunction. Sign 3. Swelling in the right foot or leg. Swelling in the feet or lower legs is often blamed on standing too long, but the liver plays an important role. A damaged liver produces less albumin, a protein that keeps fluid inside blood vessels. When albumin levels drop, fluid leaks into surrounding tissues, causing swelling. This swelling often worsens by evening and may feel heavy or tight. In some people, it appears more on the right side. Persistent swelling should never be ignored, especially when combined with other liver symptoms. Sign 4. White or yellow bumps around the eyelids. Small white or yellow bumps around the eyelids are called xanthelasma. These are cholesterol deposits under the skin. When the liver struggles to break down and remove cholesterol, excess cholesterol settles in soft tissues, especially around the eyes. These bumps are painless and often dismissed as cosmetic, but they are linked to fatty liver disease and poor bile flow. If these bumps appear suddenly or increase over time, it may signal that your liver is not processing fats properly. Sign 5. Pressure or discomfort on the right side. A dull ache, heaviness, or pressure under the right rib cage can point to liver stress. This is where the liver sits. When bile becomes thick and sluggish, pressure builds inside the liver and bile ducts. This discomfort often appears after eating fatty foods and may spread to the right shoulder or upper back. Because the pain is usually mild and comes and goes, many people ignore it. Repeated right-side discomfort can be an early sign of liver or gallbladder trouble. Sign 6. Purple or red spots on the skin. Frequent bruising or red and purple spots on the skin can indicate liver problems. The liver makes proteins needed for proper blood clotting. When these proteins are low, blood vessels become fragile and break easily. This leads to bruises or small bleeding spots under the skin, often on the arms or legs. Poor circulation linked to liver disease can make this worse. Occasional bruising is normal, but frequent unexplained marks should raise concern about liver function. Sign 7. Cracked heels. Cracked heels are often treated with creams, but sometimes the problem starts inside the body. Vitamin B3, also known as niacin, is important for healthy, hydrated skin. When the liver is under stress, it may use stored nutrients for repair, leaving the skin deprived. This can cause dry, thick, cracked heels that do not heal easily. If cracked heels appear along with fatigue, digestive issues, or other liver signs, they may reflect nutrient depletion linked to liver stress. Sign 8. White or clubbed nails. Your nails reflect circulation, oxygen delivery, and protein balance. In liver disease, nails may become pale or white. Some people also develop clubbing, where the fingertips enlarge and nails curve downward. These changes happen slowly and are easy to miss. Nail abnormalities often appear along with swelling, fatigue, or itching. While nail changes alone do not confirm liver disease, when combined with other symptoms, they can offer important clues about long-term liver strain. Sign 9. Dark urine. Dark yellow or brown urine can be a serious liver warning sign. Bilirubin is a waste product that the liver normally processes and removes through bile. When the liver is damaged, bilirubin builds up in the blood and passes into the urine, darkening its color. This change often remains even with good hydration. Dark urine is common in hepatitis, fatty liver disease, and bile blockage. When paired with pale stools or yellowing of the skin, it should never be ignored. Sign 10. Jaundice. Jaundice causes yellowing of the eyes, skin, and sometimes the gums. It happens when bilirubin levels rise in the bloodstream. A healthy liver removes bilirubin efficiently, but a damaged liver cannot keep up. Jaundice often develops slowly and may not cause pain, which leads many people to delay medical attention. Even mild yellowing is a clear signal that liver processing is impaired. This is one of the most visible signs that the liver is under serious stress. Sign 11. Spider veins. Spider veins are small, web-like blood vessels visible under the skin. They often appear on the face, chest, arms, or legs. Liver damage disrupts hormone balance, especially estrogen metabolism. Higher estrogen levels weaken blood vessels and increase pressure inside veins, making them more visible. While spider veins can have other causes, a sudden increase or widespread appearance may point to chronic liver disease, especially when combined with fatigue, itching, or digestive problems. Sign 12. Persistent itchy skin. Ongoing itching without a rash is a commonly missed liver symptom. When bile acids are not properly filtered by the liver, they build up in the bloodstream and settle under the skin. This triggers itching that often becomes worse at night. Scratching provides little relief and can damage the skin over time. Many people rely on creams, but the root cause may be poor bile flow and reduced liver detoxification rather than a skin condition. Supporting and healing your liver naturally starts with improving bile flow, which is essential for digesting fats and removing toxins. Beginning your day with organic coffee can help reduce liver scarring, and adding turmeric instead of sugar supports inflammation control and bile movement. Staying well hydrated throughout the day keeps bile thin and flowing smoothly. It's equally important to remove inflammatory seed oils like canola, soybean, corn, cottonseed, and margarine, and replace them with healthier fats such as butter, ghee, coconut oil, tallow, and extra virgin olive oil, which protect liver cells and support hormone balance. Eating sulfur-rich foods like garlic, onions, leafy greens, broccoli, eggs, mushrooms, oily fish, and walnuts helps the liver produce glutathione, its most powerful detox compound. Cutting out sugar and processed foods is critical, as excess sugar affects the liver much like alcohol does. In some cases, bile support supplements may help, but they should always be used under professional guidance. Intermittent fasting also gives the liver time to rest and repair. Your liver doesn't fail loudly. It whispers first through your skin, eyes, nails, and digestion. These are early warnings before real damage begins. If this video helped you, please like it, share it with friends or family who may need this information. Subscribe for more life-changing health content, and thank you for watching. Your health is your responsibility. Start listening today.